So Hannah and I are going to talk about concussion prevention and management. Sports-related concussions are a traumatic brain injury induced by biomechanical forces that typically results in the rapid onset of short-lived impairment of neurological function that resolves spontaneously. In the United States alone, it is estimated that 3.8 million sports-related concussions are reported each year. So understanding concussions is important because it has potentially severe consequences related to concussive impacts and repeated concussions over time on athletes. Some of the issues related to concussions are the overdiagnosis or underdiagnosis of a concussion. If you have an overdiagnosis, athletes can unnecessarily miss games, lose training time, and even suffer reduction in play, while the underdiagnosis of concussions becomes a public health concern, which may lead to neurodegenerative processes later in life.
The pathophysiology of concussions. Obviously, we know that it begins with an initial injury. This leads to stretching of the axon. Then, excitatory neurotransmitters such as glutamate will depolarize the neuron. That leads to a massive release of neurotransmitters, causing a calcium influx and potassium efflux. Then that means that the sodium potassium pump is having to work harder. So there's going to be an increased demand for ATP, but there's not going to be as much ATP. So you're going to have a decrease in ATP plus the increased demand, and that's going to create a metabolic crisis. You can see on the image that the cell in this condition is extremely vulnerable. So this is the reason why we want to prevent further concussions.
When looking at the research, I found an article that came up with 5 primary neuropathic explanations for sports-related concussions. The first and most common one is abnormal buildup of tau proteins. This leads to neurofibrillary lesions, loss of neuronal network connectivity, and mast cell death and dysfunction. The second reason is white matter tract changes. So there's alterations in myelin and involves changes in microstructure leading to delayed action potentials and signals. The third is neuronal connectivity alterations. Reduction leads to delayed coordination and communication between regions, loss of cognition, and other neurological signs. The fourth is reduction in cerebral perfusion. Concussion symptoms resulting from trauma changes in the cerebral blood flow and potentially ischemia. And the fifth reason is gray matter atrophy. Concussions and trauma leading to overall shrinkage of cortical and subcortical structures like the thalamus and hypothalamus.
Here are some common symptoms of concussions. I will let you read them. One that I want to point out is personality and emotional changes. This is important because it's common that patients will have depression along with a concussion, and this is something that a lot of people don't clear the patient for before returning them to work or play. So it's something that we need to keep in our minds that this is a potential side effect. Also, tiredness and sleep problems. Insomnia is very common among concussion patients, and a study showed that up to 50% of patients report having difficulty falling asleep or staying asleep. This is important because it can be very distressing for the patient, and they may be tired or fatigued during therapy session. So that is another thing that we want to keep in mind.
The potential risk factors for having a concussion include having prior concussions, participation in full or limited contact sports, the position played in a sport, female sex, older age, occurrence of migraines, alcohol and drug abuse, dementia, motor neuron disease, depression, and several psychiatric disorders.
So, along with risk factors, we also have factors that affect prognosis. For age, adolescents were shown to recover slower. The presence of amnesia also was shown to slow recovery. For the rest of these on this list, it was shown that they had more symptoms and lower cognitive scores, with a higher level of exertion post activity, with presence of headaches, symptoms of fogginess, multiple concussions, and female gender.
So, continuing with prognosis of concussions, most concussion symptoms resolve within 14 to 21 days. However, underdiagnosed and poorly treated concussions can delay recovery significantly. Another concern is second impact syndrome. This is a serious and preventable complication that can occur after concussion. While a patient has a concussion that they're dealing with and they are allowed to play or have a second concussion during that time, it can increase the chances of a permanent brain damage. And it could lead to learning disabilities, personality changes, and walking disability.
The intervention progression for concussions is going to begin with medical management, which is going to be done by their primary care physician, and they're going to be doing musculoskeletal and vestibular physical therapy. After that, they can progress to minimal to moderate aerobic conditioning and strength training. Then they'll be able to progress to functional training for work or sport, which is going to include high velocity activities. They will not be able to return to play until symptoms are fully resolved and neurological and cognitive testing is normal. And then at that time, their sport specific training, they're going to train with their specific equipment. So, an example that I saw of this is that virtual reality can be used for patients to simulate combat. These intervention considerations are common impairments that we'll see in patients with concussions, and it is what we want to address in our vestibular physical therapy. For gaze stability deficits, that is difficulty focusing on an object while moving the head at the same time. So we want to do gaze stabilization exercises for that. For visual motion intolerance, that's like looking at a complex background. We want to do opticokinetic training for that, and that is gradual reintroduction of moving backgrounds. So we'll start with a static complex background like a checkerboard pattern and progress to something like a moving computer screen. For motion sensitivity, we want to do gradual reintroduction of head motion, and with this we can vary the velocity and the complexity of the head motion. For postural instability, we want to incorporate dual task, static and dynamic balance exercises. And then we also want to consider their exertion intolerance and help them work up to an area where they can get back to their sport or work or whatever they need to do. For concussion management in the acute stage, we want to make sure that the patient is doing physical and cognitive rest. This is important for improving the prognosis of the concussion. During this time, we also want to tell the patients to avoid cell phones, televisions, and video game screens due to their visual motion intolerance that can make their symptoms worse. We want to make sure we are educating the patient, especially about the risk of getting multiple concussions, and that's also why resting is important. We want to give both written and verbal communication to the patient and their parents if they're a young athlete. So we want to hand out pamphlets and explain to them what they're supposed to be doing. We also want to be doing activity restrictions this time. As I mentioned earlier, we want to only progress when this patient is completely symptom free. We also need to rule out BPPV during this time and treat that if there is an underlying case of BPPV. If this progresses to a more chronic TBI, some signs that you will see is migraine headaches, which are going to interfere greatly with the patient's activity tolerance. You also want to address any cervical or other musculoskeletal injuries. And as I mentioned earlier, we also need to be aware of emotional distress, such as depression. For these patients, we can incorporate relaxation and stress management.
So another concern with concussions is chronic traumatic encephalopathy, or CTE. It is a degenerative brain disease found mainly in athletes, military veterans, and others with a history of repetitive brain trauma. It is linked to a protein called Tau, which forms clumps that slowly spread throughout the brain, killing brain cells. Symptoms have been seen as young as 17 years old, but generally don't appear till much later after repetitive concussions. Symptoms can be behavioral and emotional changes such as agitation, apathy, aggressiveness, suicidal thoughts, and poor impulse control. And factors that increase the risk, other than having multiple concussions throughout a person's life, is the length of exposure to head impacts and the age of the first exposure. Patients younger than 12 typically have worse long-term outcomes. Prevention of concussions. So, protective sport equipment such as headgear and mouthpieces have been worn, but have actually shown not to decrease the risk of concussions. There have been some studies show that it slightly increases the risk of concussions when wearing headgear and mouthpieces because players tend to play more aggressively, possibly due to the misconception of headgear's concussive preventative effects. One thing that has shown to prevent the risk of concussions is the education and stricter enforcement of rules in sports. One study I looked at was with soccer, and it showed that with more educated officials and stricter enforcement of rules in the game, that it actually decreased the risk of concussions. Another thing we can do is utilize safety equipment such as seat belts, handrails, grab bars, and baby gates for functional activities. So when treating patients with concussions, you will probably also have to educate the parents and coaches as well. Sometimes parents and coaches get caught up in the game and forget they should be placing the safety of their player or child ahead of winning. And for this, there's a couple of resources out there that have shown to be very helpful. One of them is the Centers for Disease Control and Prevention's Heads Up program. This has shown that coaches who have taken this course have lower rates of concussions and faster return to play with high school football players. And then another resource is Concussion Recognition and Concussion Knowledge mobile app, which can help coaches know when a player is having a concussion. Educating coaches and parents on when a player is having concussion and what to do moving forward can help decrease the rate of underdiagnosis of concussions. Another resource out there is impact testing. It stands for Immediate Post-Concussion Assessment and Cognitive Test. It is a test that takes about 25 minutes on the computer, and it's testing 6 key areas. Those key areas are attention, speed of processing information, verbal memory, visual motor speed, and multitasking ability. This is the only FDA-approved tool for concussion assessment, and you need to be a credentialed impact consultant to administer the tool. It is developed to be administered immediately after a concussion. It is not a diagnostic test, but it helps with treatment planning and prognosis of the patient. It works best if there's a baseline test to compare it to prior to the concussion, but it's not needed for this tool to work. So we added here just a couple of resources we found for continuing education courses specifically for healthcare providers such as physical therapists that might be useful to look into.